soon the hand tremors started being a thing.
A Burnaby woman who says her and her doctor believe she has long COVID is desperate for treatment to help with her symptoms. But currently you have to wait 3 months after your COVID infection to be considered for one of BC's post-COVID recovery clinics. And she just doesn't feel like she can wait that long.
Extremely annoying to feel I'm going through these debilitating symptoms. Like going up the stairs in my own house is such a struggle. I can't do normal things.
Kaylee Jamieson first tested positive for COVID in late December. And a month later, at the end of January, she noticed an onslaught of symptoms returning, in addition to her consistent fatigue.
It's honestly just been miserable. Every day, I'm waking up and doing a self-assessment, like, okay, is today going to be a bad symptom day, or can I get through this? And some days I wake up and I already feel so weak and my hands are already shaking.
Now, with a little over 4.5 more weeks to go before she'd even qualify for the recovery clinics, Jamieson is wondering whether the province will open up eligibility for those like her waiting in limbo for help. We asked Provincial Health Officer Dr. Bonnie Henry why 3 months is the benchmark and whether that timeline should be re-examined.
One doesn't meet the criteria for long COVID until 12 weeks from your infection. So that's a standard definition that people are using around the world. It doesn't mean that people don't have symptoms in that period of time, but many people, they'll resolve within 12 weeks. One thing that is clear is that there are a variety of different symptoms that have been consistently associated with people having long COVID, and it reminds us that this is a virus that affects more than the respiratory symptoms, the respiratory system. It has effects on our blood vessels, on our blood system, on our heart, and on our neurological systems.
But Jamieson feels if there are clear long COVID symptoms, why not create more flexibility in the 3-month timeline? And she says she is not alone in these frustrations.
Just consider this segment of the population out there that's stuck in a weird limbo in between mode. Like, I don't know what you're expecting us to do in the meantime. I know there's others who are even worse off than me who have been dealing with this for much longer, but just because they don't satisfy some universal requirement, despite the broad spectrum or range of symptoms that patients could be experiencing.
Ashley Burr, City News.